Okay, this, as we mentioned before, this is a materials science course, a basic science course, and we won't spend a lot of time talking about dental applications, but at the beginning here, I would like to allude to some dental applications for ceramics and the important properties that ceramics have for dentistry, just so that you understand the pertinence of the information that you're learning about ceramics. And so we have a wide variety of applications for ceramics in dentistry. What many people think of as applications for ceramics are included here in the fixed prosthodontics category, indirect restorations. These are repairs that are made to teeth by fabricating a ceramic prosthesis in the dental lab, shipping that to the dental clinic where it is then attached, cemented onto the patient's tooth. And we have a variety of types. We have idealized tooth there. We can make a ceramic inlay, which is kind of shaped like a cavity filling that gets cemented into only the fossa there. We have an onlay, which also covers the cusp of the tooth and the fissures in the middle. We have porcelain laminate veneers that can be placed on the front of the anterior teeth. We can make a full coverage crown out of ceramic layered with various types of ceramics, or sometimes a ceramic fused over another material like metal in the core of the crown. And then, of course, we have bridges or fixed partial dentures that are like crowns except for multiple teeth. So these are the applications that most people think of as they would assume might be the only applications for ceramics in dentistry. However, there are other important applications. For example, composite fillers. Dental composite is used as a direct filling material to fill the cavity preparation, and that is typically a polymer based material. However, the polymer doesn't have enough stiffness and dimensional stability to be used by itself, and ceramic powder is used to fill that polymer and to make it stronger and keep its shape better. And actually, by volume, the dental composites contain more ceramic than they contain polymers. So that's an important component. We have orthodontic brackets. Typically, those are metal. When the patient would like them to be tooth-colored or transparent, aesthetic brackets can be made out of polymers or out of ceramics, and those have been shifting over the past decade more and more to be made out of ceramics. Other important applications for ceramics take advantage of their hardness compared to other classes of materials, and so ceramics can be used as a coating on top of another material. Other important applications of ceramics include a surface layer on top of another material. An example would be a dental implant. It can have a hydroxyapatite ceramic coating, plasma sprayed on the surface to be bioactive and to speed the rate at which that implant is osseointegrated into the bone. Another use for ceramics in dentistry is is bony defect fillers. Calcium phosphate cement is an example of those type of ceramics. And that could be placed in a patient's jawbone if they need to receive dental implants, but there's not enough bone there to support an implant. Then that bone can be augmented by a ceramic material, which in some cases can be resorbed and turned into natural bone over time. And another application would be if the patient needs a tumor removed from their jawbone, and that leaves an empty space that can then be filled in with ceramic material. Ceramics are very hard, and so they are used as the filler in abrasive pastes. So the paste will contain small hard particles of ceramic that make it abrasive. Other applications in dentistry we call auxiliary applications of materials. That is where the ceramic material itself will not come into contact with the human body. However, it will be used to shape or process other materials in the lab that will then come in contact with the patient. One of those is to make casting investment. An investment is a mold that we would use, for example, a ceramic mold to melt gold alloy and cast the molten gold alloy into the shape that it needs to take to form a prosthesis. High temperature dye similarly is it's a ceramic in the shape of a tooth that can then have a crown or bridge built on top of it, and that can be placed in the furnace and taken to high temperature without melting. Okay, so I'd like to introduce the properties of ceramics by contrasting the ways in which they're different from other classes of materials such as metals and polymers and also composites such as natural teeth. Some of the main differences are, first of all, that they are refractory. So refractory is a fancy way of saying that they have very high melting points. They're resistant to increases in temperature. They also, although not all ceramics are chemically stable, most of the ones we encounter are very chemically stable. Essentially, ceramics are oxidized metal, and so we talk about metal oxidizing or corroding over time. Well, the ceramics have already undergone that process to become a ceramic material. And so they're usually not susceptible to additional degradation chemically. An important property, especially for dentistry, is that ceramics have the potential, depending on how they're processed, to be transparent or translucent, almost transparent. And that's important because a natural tooth is not opaque, but it actually has several layers in different levels of translucency and different color that allow the light to penetrate into the tooth and come back out to the observer's eye. And so it's important to have layers of material that are translucent to reproduce this lifelike appearance. Ceramics have much lower thermal conductivity than other classes of materials. And as we mentioned before, ceramics are very hard, which is why they're used in abrasives. And unfortunately, they're brittle, which makes their strength very sensitive to the presence of flaws or processing defects. And it makes their strength or the lifetime of ceramic parts less predictable than parts made from other types of materials. And I've included some asterisks here to indicate for each of these superlative properties whether that happens to be an advantage for dental applications or a disadvantage. Refractory is a disadvantage for dentistry. In many material science applications, having a high melting point is good. That's the reason we choose a ceramic for those applications. In dentistry, it makes the material difficult to process, which makes it expensive to process. So that's a bad thing. Chemical stability, as you might guess, is a positive thing. We already talked about the positive aspects of translucency. Low thermal conductivity. Why would we want low thermal conductivity? That's a positive aspect. And that's because ceramic material, when used as a prosthesis, will shield the pulp of the tooth from feeling temperature fluctuations and reduce sensitivity. Hardness can be positive or negative aspect. Being harder than other materials means that ceramics are resistant to abrasive wear. They're not likely to be worn away by other materials that they rub up against. But depending on their surface finish, it can mean that a ceramic is an abrasive antagonist, which means that it can accidentally wear away opposing materials over time, like opposing dentition. So that would be a bad thing. And then we talked about how the brittleness of ceramics is a negative aspect. So keeping that in mind, the ceramic section of the course is going to cover three main aspects. The first part of this section, we're going to talk about in more detail about the differences between the material properties of ceramics compared to material properties of other classes of materials. And we're going to follow the paradigm of material science when we discuss that. And again, that to remind you that the class of material and the way in which it's processed controls its structure. And the structure and the composition of the material controls the material properties. And so we'll go into greater detail in a minute about the crystal structure of ceramics and the type of atomic bonds we have in ceramics that are different than atomic bonds in other materials, and how those affect the properties of ceramics to be different from other materials, as we already discussed. And there are two main problems we already talked about with using ceramics in dentistry. One is that they are brittle, and the other one is that they have high melting points, so they're difficult to process. And so we will spend a lot of the ceramic section talking first about the methods that we use to accommodate the brittleness of ceramics and try to reduce the brittleness of ceramics. And then the last part of the ceramics section of the course, we will talk about methods that we use for processing ceramics, how that has to be different than the methods we use for materials that can be easily melted, such as metals and polymers.